Okay, so welcome everyone. And seriously, what is the deal with Wednesday nights? I hitting start recording and Reggie is already barking up a storm. Just one second. Okay, so tonight we're going to be talking about home safety assessments and evidence-based strategies to decrease falls and improve mobility. We're going to be talking about why OTs and OTAs are the perfect fit for starting this type of practice, talking about the research and evidence, how you can start your own business, and finally, going to have more discussion on the new certification program that's only available for OTs and COTAs, and registration is finally opening for that tonight. So we'll talk about that as we move along. So let's start with Sue. Why don't you introduce and tell everyone about you? I'm guessing most people know us, but there might be a few people that don't.
Okay, sure. So I think the thing that most people notice about me is they say I talk funny. So I'm an Australian trained OT. I've been an occupational therapist for over 40 years now. I have my own practice here in Southwest Washington, and I've been doing this now for 5 and a bit years, predominantly in home mods, though I do see other clients. And I've kind of worked in most areas that OTs can work in the 40 years, but this is one area that's been really great. And this is my second private practice. I had one back in 1983 in Australia before it was very fashionable. So that's kind of a little bit about me.
Awesome.
And you love my accent.
And for those of you that do not know me, my name is Kara Welke. I'm an occupational therapist, 21 years, and 21 and 21. That's kind of cool. I guess I did graduate in 2000, so I shouldn't think that is too cool. But anyways, I have my own mobile Medicare Part B practice working with older adults. And yeah, today was kind of a big moment for me. So I've utilized independent contractors, and I've been working on putting together a benefit package so I can transition into employees and provide health insurance and so forth. So I made an offer for one of our independent contractors to move over, and she was super excited about that, and kind of feel like a bigwig now that I can offer insurance and all of that to my employees. So that's exciting. So tonight we are going to kind of fly through some of the beginning stuff because I feel you guys are probably pretty well versed in that. But if you have questions or anything as we go through, just put it in the chat or raise your hand or whatever, and we'll slow down and answer your questions as we get going.
Kara, before you go any further, I'm just going to ask Deb. Said she was having trouble hearing us. Is everyone able to hear us fine? Okay, I see quite a few yeses. So, okay, just wanted to make sure.
Okay, awesome. Okay, so the objectives, and I didn't add some of the objectives in. So I will tell you, I was up till 3 a.m. last night because I'm trying to get Next Level approved for AOTAs, continuing education, so our programs from now on can offer CEUs, and the application's due tonight at midnight. So you all know what I'm going to be doing as soon as we're done with the webinar. So I failed you guys on this one. So there are a few other objectives. I'll see if I can remember them. Describe the impact of falls and the costs associated with falls. Identify professional screening options for falls that address Medicare and CDC guidelines. Describe Medicare and CDC guideline recommendations for interventions. Understand the evidence for OT home safety eval and the process involved. And then we're going to talk about how OTs and OTAs can start their own businesses doing this. And then we're going to talk about the other objectives is to learn about the new certification program that is finally available for people to start taking that's designed specifically for OTs and OTAs. Okay. So objective number 1, impact of falls and the costs associated with falls. 1 in 4 older adults reported falling in 2018, which equals 36 million falls. By 2030, this is expected to be 52 million falls. 55% of fall injuries among older people occur inside the home. So basically, it's clear that our population is aging, falls aren't going away, homes aren't any safer than they used to be. There's a huge need for us to get out there and take the lead and be the expert in this area. I mean, we see so many other people doing this that don't have the skills, training, and the knowledge that we have, and they don't take in the full person. I mean, I could just talk about stories forever about these companies coming in and doing these god-awful, expensive modifications. 23% of all injuries do happen outside, but near the house. So again, we know that it's not just inside the house, but around the house that we need to look at and assess. What do you guys think the total medical costs are for non-fatal falls in 2015 for adults 65 plus? Hey, Lori, I just had when I was out walking my dog, he's just a little Reggie. I fell and I thought I broke my hand for a second. So we got a 50,000. Anyone else have a guess for what's the total medical cost for non-fatal falls in 2015? We got 50,000, 2 million.
10 million, 1 million.
10 million. Okay. Well, let's see what the answer is. How about, whoops, 50 billion. And that cost is only increasing as time goes on. How about how much is spent related to fatal falls for adults 65 and above? Any idea? Throw out some guesses.
Megan said 750.
Oh, you cheater. I'm just ding, ding, ding. $754 million. Other cost of falls. So what are some other costs associated with falls besides just money? So loss of income, caregiver costs, fear. Fear is so huge. So many of my clients just are really struggling with that. Social isolation, decreased comfort, assistive equipment. Yep.
That fear of falling again.
Anxiety. Yeah, quality of life, tons of different costs of falls. People get so focused on the financial aspect of what's it costing, but there's so many more costs of people falling. So this is just some statistics and we'll talk a little bit more, but 800,000 patients hospitalized because of fall. 1 in 5 falls equals serious injury. 300,000 hospitalized for hip fractures, falls, most common cause of TBI. So we have increased fear of falls, which all of you guys mentioned. They're less active. Then they have increased weakness. And like Megan said, it's totally a circular cycle that we're dealing with. And we are doing a very poor job in many areas across the United States trying to improve this, but there's lots of things we can do if we all come together. And then the ones that you guys said, I think pretty much covered everything on here as well. The decreased social participation, loneliness, isolation, depression, anxiety, decreased ability to complete daily occupations, increased dependence on others, all of that, having to change their living environment, and so forth. Okay, so we covered objective 1 pretty quickly. Objective 2, identify professional screening options for falls that address Medicare and CDC guidelines. So assessment and management of falls in primary care settings. Less than 50% of older adults who have fallen actually talk to their providers about it. Guidelines specifically state that providers need to ask about falls at least annually. And there's 3 risk factors that must be addressed in everyone at high risk: balance, medications, and home safety. So ding, 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 that home safety is a huge, huge component of this. So who is aware of the CDC initiative? Either put yes or no, just so I know how much detail I need to go in. Okay, yes, yes, no. Okay, so get my little fun. If you guys are not familiar with this, as soon as we're done with this webinar tonight, you are going to Google, or Sue, you can put it in the chat section, but all it is www.cdc.gov/steady, and you can order all of these materials that you can use in your practice. There's a coordinated care plan to prevent older adult falls. There's handouts, assessments, there's a toolkit, there's tons of great information, but we just need to utilize it, okay? And get other people to utilize it. So please check that out as soon as you're done, or go ahead and look now, because I know I would. So some things in the STEADY initiative. Number 1 is to screen. So again, when we're working with older adults or physicians and so forth, they should have the 3 questions. Have you fallen in the past year? Do you feel unsteady when standing or walking? Are you worried about falling? And then assessments. They need to be assessing, we, all of us need to be assessing gait, strength, balance test, identifying medications taken that increase falls, asking about home hazards, again, huge, measuring orthostatic blood pressure, check visual acuity, assess feet and footwear, assess vitamin D intake, and identify comorbidities that increase falls. So I don't know if you guys remember, was it in San Diego at the AOTA conference when a lot of the discussion started about OTs and primary care clinics, or was it before that? But anyways, a long time ago, we really had a big push for OTs and primary care clinics and so forth. And I tried to get it going in a primary care clinic here. But personally, I feel that anyone 65 and over, especially those that when they ask these questions, have you fallen? Are you worried? Things like that. Why not have a home safety evaluation? Because we could totally decrease the amount of falls and get out there into these homes a lot more. But it doesn't always happen, as we know. The study has an algorithm on their site that you guys can go ahead and look at. But again, like we said, the first thing is the screening for fall risk yearly, or anytime the patient presents with an acute fall, and there's those questions they need to ask. And then there's the assessments, like the timed up and go, the 4-stage balance test, things like that. And then there's the intervention. And then in the intervention piece mentioned on, the CDC guidelines states specifically home hazards likely refer to occupational therapists to evaluate home safety. Okay, so great program, check it out, a lot of good information there. There is a 2-level versus the 3-level fall risk screening algorithm out there that they found was a suitable alternative. And what this is you ask the patients these questions, and then you do the assessments, and they're not at risk or at risk. But basically, they're just trying to get more and more people to be doing these screens and assessments out there. And this is the resource. Okay, objective 3 is describe Medicare and CDC guideline recommendations for interventions. So Sue is going to take over this part.
So when we look at that, CDC did the recommendations. They did a systematic review of the literature at that stage and put these recommendations together. Because of the cost of falls to Medicare, Medicare or CMS then decided to look at how to incorporate that in what's happening. And they have developed these annual assessments for particularly, well, not just the MDs, but predominantly MDs or their physician type provider. And so this one is the initial one. So within 12 months of a person enrolling on Part B, what they're wanting them to do is to look at covering what they call an initial preventative physical exam, right? And then once a year, they want an annual wellness visit. And so they've started to incorporate in those specific requirements. And I want to just pull out some of the key requirements of those. So if you want to move on to the next one. So in the initial exam, they really want an assessment of fall risk, interestingly, performance of ADLs, and the home safety. And again, looking at home safety continuing to come up in all the comments here. So they really are asking the providers about how do you evaluate home safety. This is going to be a really good way that you can help the providers, because how are they going to do this? So thinking about educating the primary care physicians, anyone that's seeing Medicare patients, this is what they need to do. So giving them a checklist, giving them a referral piece, giving them some cues on where they can do that, and then how to take action. So this is for the initial exam, and then look at the annual one. So again, Cara, if you want to move on, not only are they supposed to ask the questions about falls, so, and we'll talk when we get to MIPS about what to do with that. But again, annually, we're looking at activities of daily living. We're looking at those instrumental ADLs. Now, we think that Medicare is only concerned with what's happening in the house. But if you look here, they list asking questions about instrumental ADLs as a really important component of this annual wellness exam. And so start to think about what they're talking about. Shopping, food preparation, being able to use the phone, being responsible for your medication, and ability to handle finances. Now that means every primary care physician is supposed to be asking that. So thinking again about how you can help your primary care provider with asking questions that are going to direct the client to being suitable for your services. Is my volume working for people now? Okay, good. The other thing, of course, now is to look at their functional ability and level of safety. And when you're looking at that, it's saying hearing, ability to perform ADLs successfully, and then fall risk and home safety. So everything we're seeing now, home safety is listed all the way across there, as well as fall risk. And I saw a couple of people have done fall risk training and fall prevention training, all key components of us being able to offer services that are going to help the primary care physician here. All right, if we go to the next slide, why is that important? Well, Medicare has put what they call merit-based incentive payment schemes in place. In what they're really saying is, if you're billing us for services, We want you to provide a high level of service, and here's what we're calling quality service. And realistically now, when we look at this, initially it was just for physicians, and then they phased it in. Now, if we look at it, occupational therapists, physical therapists, chiropractors, all of those are now in here. And there are some requirements. AOTA has a presentation and stuff on this, so it depends on the size of your practice and some other things. There's still some electivity about it in that fact that you can choose to join and there's criteria to join. But what's going to happen is you're going to get, if you follow certain criteria for what they call quality per practice, you are going to get a pay rise from Medicare, basically. And in some cases, 5%. So this is one way, again, of being able to say to the primary care docs that you're working with, you know, I can help you meet this merit-based incentive payment scheme by helping you provide the services. So let's look at some of the ones that actually provide or apply most to what we can do. And in this stage, the one that I think is the best is this one, which is MIPS 154, which is the fall risk assessment. And this goes back to every year. And we can ask the same and record it when you're recording your MIPS data. Did you ask the patient, have they fallen in the last 12 months? If they have fallen, was there an injury? If there was an injury, there's automatically, you have to put a falls plan of care in place. But if you actually have 2 falls, you also automatically are supposed to put a falls plan of care in place. But if you look at what it says here for assessment, again, the medical record must include documentation of counseling on falls hazard or referral for evaluation for home falls hazards. So again, thinking about what's a screening tool you can help provide your primary care with, what's a way that you can evaluate or help them look at being able to make those referrals. And so then you have to record not only that you completed the assessment, but now on the next page that you established a falls plan of care. Oops, the other forward. And part of that falls plan of care refers to evaluation and adaptation or modification of the home environment, which is where the OTs and home mods come in. And in other guidelines, it actually, or versions of this guideline, it actually says referral to occupational therapy for the home safety assessment. So again, thinking about, here's what Medicare is saying, this is actually clearly part of Medicare guidelines now, particularly for seniors who have had 2 falls within the last year or 1 injury fall. And so that's part of where we should be looking or going. It's a key feature. All right, the next one, Cara. I think this was yours. And again, it's reinforcing those same guidelines and those same pieces. So these are the same kind of recommendations that come into the plan of care.
Right. So yeah, we talked about the screening, the assessment, and then the interventions that CDC Steady Initiative is recommending. And one of the key recommendations is the home safety evaluations by occupational therapists. So utilizing all of this information and really showcasing that all these places are saying that home safety evaluations by occupational therapists is huge in helping reduce the fall risk and so forth. So, and obviously there's other recommendations for interventions that they have on there as well. Okay, now we're
gonna
go ahead.
Respond to a question there. So it says, are you saying that we can bill for this once a year or the MD can bill once a year? So the IPPs that we put there, the initial physical performance evaluation and the annual wellness exam, those are MD based billing codes. And it lists that they're able to be done by an MD, an ND, a nurse practitioner, a DO, those kinds of pieces. But if your practice qualifies for the MIPS, then you also should be recording once a year or regularly that the patients have been evaluated for a falls risk assessment and that you've implemented a plan of care. And we're not going to go into that piece now, but AOTA does have a training on the MIPS that's available. If you're an AOTA member, it's a free training looking at qualifying for the MIPS and what it looks like to do that. And that will then increase your reimbursement. The other piece to understand with that is that in those situations, this is definitely and must be a billable service to Medicare. This cannot be a cash-based service under that piece. This has to be something that you bill Medicare for, because it is a Medicare recommendation for their plan of care.
Another thing, so those of you that are, in our programs and doing the age-friendly healthcare system, all the things that we do to meet those guidelines are going to help you meet the MIPS guidelines as well. Okay, so we're going to talk about the evidence for OT home safety evaluations and the process involved, and we'll probably won't go too in detail with that one, but so there's quite a few out there, and we just highlighted a few. So occupational therapy fall prevention interventions for community dwelling older adults. This was a systematic review done in 2018. And they found that home assessment, modification, or hazard abatement were part of all of the positive studies that included multifactorial interventions. Another study that was a systematic review done on the effect of home modification interventions on the participation of community dwelling older adults with conditions found again that there was strong evidence supporting single and multi-component interventions, including home modification interventions, and that it improved function for people with a variety of conditions, reduced risk and rate of falls, and reduced demands on caregivers.
And this systematic review was the one that was the basis for the AOTA clinical guidelines on home modifications. And so this is the piece, and we go through some of that when we look at our trainings.
And I'm guessing all of you know about the Capable program. If you don't, you might have been living under a rock. I'm just teasing. If you don't know about the Capable program, you definitely want to check it out. But at Community Aging in Place, Advancing Better Living for Elders. So this is an interdisciplinary program. I don't know if Dawn's on here tonight, but she's part of the Capable program where she lives. If any of you guys are part of the Capable program, let us know. No one's going to tell us they don't know about it after I said that. But anyways, this is an interdisciplinary program that involves nurse, OT, and handyman. And it's an evidence-based program, 5 months, and it addresses the home environment. And overall, it's designed to increase mobility, functional ability, and the ability to age in place. For low-income older adults, average improvement, or they found that for low-income older adults, the average improvement was about 50% reduction in their degree of disability. They found it increases their function, lowers their hospitalization, and nursing home rates. For this program, it cost on average, almost $2,900 per person, and it reduces Medicare costs over 2 years, $22,000.
And interestingly, this is something you can institute as well, depending on where you are in terms of getting the handyman funding. But these are things that different agencies have been working on and looking at putting together. But you can actually do that in your own private practice. You can work with the physician to look at some of this and then look at engaging the handyman. But the key part of this they found was, again, the occupational therapist. That was the key component, and those 4 to 6 visits. And I think that's really important because it's not just coming in and making the recommendations, it's the OT being engaged in the process with the client and doing the follow-up training that we're finding that really is what's substantiating more of the carryover and the effectiveness.
Yeah, exactly. I mean, I'm not a one and done type person, but yeah, the 4 to 6 visits is key. So Cindy, she said that a home care agency in New York is doing this capable study. Then Pamela said her agency is in the planning stage of capable, and she's going to be the OT. So that's awesome as well. This is another study, a randomized controlled trial of prevention of falls in people aged greater or equal to 75 with severe visual impairments. It's called the VIP trial. Anyways, they found that the home safety program, which was the home hazard assessment by an OT, home modifications, and the recommendations for behavior change, or that was one group. Just the Otago exercise program and vitamin D supplementation was another group. The combination of the home safety and exercise program was one group, and then social visits was another group. So what one of these groups do you think had the best outcome? The home safety program alone, the Otago exercise program, or the combination of home safety and exercise, or the social visits? Anyone have ideas of what? Okay, we got a few guesses in here.
Combo is what I'm seeing.
So the outcome was that the home safety program was the more cost-effective and reduced falls. And then some key elements highlighted: the OT's advice rather than the environmental changes was key, and a trained and experienced OT is critical to the success of this intervention. So I thought that was interesting. Another study looking at home visits by an OT for assessment and modification of environmental hazards, and this is a long time ago in 1999, but the intervention was a 1-hour home visit by an OT, and the results were that the intervention was effective among subjects who reported having had 1 or more falls, and 50% of the recommended home modifications were in place at 12 months follow-up. This study is a home assessment and modification study or report. I can't exactly remember, but OT or home care worker completed a home assessment intervention only effective when implemented by OTs. So they had a couple people go out there and do that, and they only were effective when the OT did it. And the fall rates were reduced by 46% when the OTs did it. So again, if we can, I mean, the evidence supports what we're doing, and I just don't think we've done a very good job overall of really promoting that we need to be the key people out there doing that. And love you PTs dearly and so forth, but that's one reason why the home or the certification program that is starting is only for OTs and OTAs, because the evidence supports that we are the ones that should be out there doing these. Unmet need for equipment to help with bathing and toiling. This one was pretty new. I don't know if you guys, I think it came out in March of 2021. And they looked at just over 2,600 community dwelling older adults, and 42% of individuals 65 plus lacked grab bars or bath chairs to help them bathe and toilet. I mean, each day I go out and see clients, I'm usually shocked by something I see in the environment. You just never know what you're going to find out there. But so that number really doesn't shock me, I guess. But
well, I think the interesting part with that study, and I think this might have it, is that that people already had the impairment and they were reducing their participation in really basic self-care tasks. And there's another study that looked at 35% of some of the seniors weren't even taking a bath regularly because they weren't able to access bathroom or felt unsafe and in fear. So again, a big area.
Yeah. And so within this study, they talked about how if clients are having increased impairments or falls, medical providers should ask about their home assessment or their home setup, and they should be having an OT do a home safety assessment. Also, we all know that there are home safety assessment tools that can empower clients and caregivers to identify hazards and solutions out there. But the key is, to get the professional in there, which is OT, OTAs. Also work with professionals on installation. None of the, just whoever installing whatever, that's not safe out there. Yeah, no, I agree. We're very underrated. And this is some great evidence that we can utilize to support and help us build the practice for our business. So this is more information from that article. So they talked about why older adults do not have the equipment they need. So one, they do not know when or what equipment they need. So us as therapy professionals, it's just common sense to us. But other people really don't know what's out there. I mean, they think a towel bar is a grab bar. What's the difference? They don't know how to get the equipment or how to install it. Again, that might seem stupid to us because it's just obvious, but other people don't know. People are not.
I have a great story on that towel bar I'm going to interrupt you with. I was assessing this lady in her apartment. She's like, I'm fine. I'm fine. I've got this. I can really help, as it wiggled out of the wall and the towel rack as she was heading to the bathtub. And she said, they've just replaced it for me. And they did it 3 times so far this year.
Yeah, it's crazy. People are not familiar with services available. Again, people still don't know what we do, right? Adults do not get taught what they need as they grow old. So we need to be thinking about how can we do things to educate, and are there services that we can be offering adults a little earlier on that is more of the home safety type things that educate them and have them planning ahead. The other thing they highlighted in this article, they talked about physicians, that few physicians are actually skilled at identifying disability that warrants equipment, asking the questions they need to about home environment. They're not educating on available options and making recommendations or referring clients to the solutions they need. So again, just getting in there and educating the physicians and letting them know, if someone talks about their home or a fall or declining anything, that should be an automatic trigger referral to OT. This is an interesting study that Sue pointed out. Do you want to talk about this study, Sue?
This one was really interesting, and it's relatively recent as well. We often just think about it in terms of physical safety or physical ability. In this situation, they studied 70% of older adults that didn't have any accessibility features, and they live alone, and they found they have a quicker decline cognitively in brain function. And if they actually made the space more accessible, so at least one accessibility feature in that home, and generally it could have just been a grab bar, what they found, they were less likely to have brain function decline and memory loss. So the home environment has direct effect on mental health, not just physical. And I know we're talking about older adults at the moment, but there's several studies looking at the outcomes for people with schizophrenia, looking at younger adults and mental health issues. So this is really amazing to know that whole piece that we as OTs have known for ages, right? That a person, you can't break them up into compartments. and their whole overall health is bound together with those safe and successful completion of those meaningful occupations. And this is just really true. And the studies are now starting to catch up with us OT's knowledge and put it out there. And I see someone that says, I work part-time in acute mental health, and we have Jerry patients coming into us all the time after a fall. And I think, again, this is where looking at prevention and looking at wellness and looking at establishing that part of your practice is also a key component, because we have the studies to say that taking these factors into account, looking at accessibility, looking at those pieces, is actually going to help us be able to maintain cognitive function, wellness, and mental health as best as possible after all.
Yeah, I love this study because we tend to just think about the physical aspects and not that it actually involves decline all the way around. Okay, this was just from AOTA. Occupational therapy practitioners have a long established proficiency in addressing the impact of the environment on occupational performance. As such, home modification recommendations and services fall well within the scope of occupational therapy and are recognized in most state practice acts. So, which we all know this, but it's just good information to share with other people to let them know, that we are the best for this. So when home modifications are part of a skilled plan of care, they can be a covered service under Medicare. Now, we hear this so much out there about all of these therapists trying to just do private pay home modifications, home safety, and so forth. And it's just not that clear cut. Home modifications, assessments, and so forth, depending on the situation, need to be billed to Medicare if it's appropriate. So you really need to embrace the hybrid approach to your practice and utilize it to your benefit to build your practice, just being so cut and dry with only private pay or cash pay. There's a way to mix it together, and that will benefit you. It'll benefit your clients and everyone in the long run. Anything else on that, Sue?
And to follow legal requirements, because as occupational therapists, we can't hide our qualifications as occupational therapists. We're going to be held to our highest level of qualification, but also we have mandatory billing requirements for Medicare for services that they will cover. And as you can see earlier, home safety assessments are something that's very much covered when it's identified as a medical necessity.
And I mean, I see this daily, that people still are not understanding the fact that we as OT professionals cannot just charge a client cash or private pay just because we want to. If it's skilled or medically necessary, we need to submit the claim to Medicare.
Or the patient wants to pay cash either. That still doesn't get us out of those requirements.
I know, and I still don't believe that. Really, how many patients want to pay cash versus utilize their insurance? But whatever, sorry, I get cranky on that.
I have found one, and I was treating him in his $4.5 million home. So that's the only person I found that wanted to pay cash.
I know, that's interesting. All my clients really like to use their insurance benefits. Okay, so home evaluation process, why OT versus another professional. So I'm not going to go through all of these because I feel we know them. We can get you the handouts. You can look at them later, but just for time's sake, I'm going to go on to some of the other information. But depending on the state and funding source, a doctor's referral may or may not be required. Again, depending on the client's insurance and the client's situation, it may or may not be covered by insurance. Occupational therapist does need to be skilled in the home evaluation process, requirements, and available resources in the community and state. I always say you need to be the expert in your area and state. You know, like tonight I'm filling out, a grant for $2,500 for a client. There's so many resources out there that we can utilize, and you need to know all of those to help people with these modifications. Occupational therapist completes the initial evaluation and will determine appropriate next steps. And then, of course, we always work with the entire team, including the family, during the process with this.
And in our program, we have a nice kind of flow sheet checklist to help you decide on that process. I see a comment in here that I think we can address now. It says, wait, I think of Medicare as an insurance for the body, not the stuff that keeps them safe. Are you saying this is incorrect? So funding the modifications is one thing, but identifying the need for the modifications is another thing. And Medicare has made it very clear that a home safety assessment that removes hazards, identifies the need for changes, is often identified as medically necessary and is covered and funded under their program. Now, if we start to talk about who's paying to widen the door, that's another whole different question. And we go through funding options and sources for that. That's where I love working with my QMB clients who are Medicare, Medicaid, because we have very clear funding sources to help with those options. But so the evaluation, the skilled OT services, the identification of the needs for modification, the identification of the way to remove the hazards, improve the safety, the training and developing those as into the client's habits and routines, that is all definitely covered, mandated, and billable to Medicare. So just my 2 cents on that.
Again, supported in all of the insurance. I mean, in all this evidence that we talked about and with the CDC and all that stuff. So
yeah, one of the things to think about, there are some changes in Medicare Advantage programs. When President Trump signed the Chronic Care Act in 2018, it's been phased in over the last couple of years, and it allows the Medicare Advantage plans to actually offer different services to clients. In that area, they are actually allowed now to cover ramps, grab bars, and some of those modifications. But the problem has been that each plan is allowed to do their own thing. So now we're trying to work, and that's where needing to work with the plans that are available in your local area, start asking and start saying, when have you implemented these requirements that came in under the Chronic Care Act? So those are all the key components. Someone's asking, under what code do we bill Medicare? We use our regular OT codes. This is seen as standard OT practice. We talk about effective and efficient ways to do that in our program, but this is OT practice. You evaluate the client, then you look at the impact of the environment on their performance, and so you use the standard OT billing codes.
Okay, so we're going to do just a few case studies, and you guys need to participate, right? So the first client is a male, 94 years old, quite a bit of diagnoses here, and he has assists with medications, catheter management, shower. Routine, gets up between 6 and 7 and spends majority of day in room watching TV, lives a spouse who has dementia with significant behavioral concerns. Client was in hospital, went to nursing home, went home, then back to hospital, nursing home. Was questioning if they could go home or not. So this is the client's bathroom. What do you identify? Let's start with concerns. And in our Home Mods Facebook group, if you're not in that, you need to make sure you join us. So you've probably seen this one in here if you are in our group. We like to do these. What concerns do you guys have looking at these pictures? Okay, needs a shower chair, rugs, tall bars as grab bars, declutter, clutter on floors, large step into shower, raised toilet seat, tub toucher, vent clutter. That sounds good. Item floor, no go bars, rugs, items floor. Okay, good. Is there any positives to this environment that you guys see?
Some said the higher toilet, the grab bar that's there.
And so I'll just tell you, this toilet is low. It might look high, but it's low. And the grab bar just cracks me up. When you sit on the toilet, you have to reach like high up, and it was totally not functional for this guy. The grab bar is a suction cup grab bar that comes undone continuously. This bath mat was a slick, awful disaster waiting in place. So many different issues going on with that. So, but yeah, lots of easy fixes and changes with that one. Okay, let's look at another one. This is an 86-year-old, quite a few different diagnoses, recent hospitalizations, a lot of in and out. Was actually living in an independent living apartment, but moved to a condo with spouse. Assist for shower, can dress self, assist for all IADLs, so forth. She likes to be around people, walk. She actually was mad because she liked the independent living apartment better because she could get out and walk in the hallways than moving to the condo with her spouse. So this is her bathroom. What do you guys see as issues in this bathroom?
Someone said they don't like the bench. Yes, I'm with you on that one. I'm not a built-in bench person.
So let me tell you about this bench. She has continued to fall off this bench because it's not the appropriate height. Do you guys know? I mean, they spent thousands and thousands and thousands of dollars on this bathroom remodel from a professional medical accessory company to do that. I'm guessing there was no OT involvement in this situation. Not to mention, if you're going to go through, this is, again, you all know, those who know me know I'm very opinionated, but if you're going to go through this remodel and spend this much money, why couldn't they make it look a little bit more modern and universal design versus the big old silver industrial handicap bars? Yes, it's ugly. That's better put.
There are so many cute ones out there now. I just finished building my new home, and I have wave ones in there, and my shower. Anyway, yes.
Yeah, I do like their barn door, but it was a little heavy for her to be able to open. So. Oh, actually, Sue has a lot of pictures and videos in our certification course. So
some people were saying about the toilet getting in that area getting wet. And I just want to tell a story. They did that when they remodeled my father's bathroom with the VA in Australia. And so my mother was falling then because it was wet. So I actually packed my suitcase up to go to Australia with a shower dam and all kinds of modifications in it. And you would not believe the questions I got asked at customs, and also if they were checking that I had drug stuffed inside the dam. But there are ways to still do that and still have that open space. And that may be necessary in some bathrooms. So there are things that we can recommend and do to protect the toilet area from getting wet and slippery. But yeah.
Okay. This one is an 88-year-old, obstructive sleep apnea, basal cell carcinoma, spinal stenosis. He's in an electric wheelchair for all mobility. Transfers vary. Some days min, some days max, some day max assisted 2. You just never know. Stands for about 1 minute. So just a little education on this. He had one of the fiberglass showers that had the built-in shower chair that, no one could sit on and so forth. And we talked about doing something like this, and that I could help them with this process. And in the meantime, I think he went into or something was going on, but the COTA was working with him. But in the meantime, I came here and this is what I saw without them asking me for anything. Any ideas of problems in this brand new designed bathroom that you could see for someone that can't stand? It's going to be sitting. Yes, shelves too high.
And the controls to go with it.
Yeah, and where's the shelf at, people? I mean, is he really gonna get behind it here? And then to top it off, you guys should have saw where they were gonna put the grab bars. Like the place they had marked out for the grab bars were like for someone that is standing. And I mean, it was just insane. And I'm just like, oh my gosh, people, it's just frustrating out there. So anyways, it's another one. Okay, last one. This is a 76-year-old, Parkinson's, history of falls, CVA, assist to varies day to day. He had a stroke in December. And after that stroke, he was really more impacted cognitively as well. And this might be a little hard to see, but this is a floor plan. So I went to evaluate this person like right after, right before New Year's, I think it was. It wasn't even January yet. And I'm Snoopy, of course, and I just happened to see this laying on the table. And I was like, are you doing a bathroom remodel? And I'm like, can I take a look at that? So this is what the company, and I think they paid in the $40,000 to $50,000 for this, but this was the floor plan that they were going to do. Do you guys see any problems with this floor plan? And if you don't know how to read floor plans, that's covered in the certification program. So. Okay, so yes, they have this built in. So this right here is the shower. This area, this 30-inch area is the doorway into the shower. This is a shower head. This is a shower head. This is a built-in. This is a small little area by the toilet. Here's the door into this area. And then the vanity. And then in this room, there is a built-in bathtub or jacuzzi for the wife and so forth. So yeah. Okay, so yeah, this guy has Parkinson's. What does Parkinson's do? I mean, it's not like he's all of a sudden going to be getting better. Well, I mean, he could because we're miraculous therapists, I know. But anyways, so we caught it in time and we were able to make a lot of pretty significant changes. Not quite everything I had hoped and wanted in it, but if I wouldn't have gone there that day for that evaluation, this is the bathroom they would have had and they would have paid, $40,000, $50,000, $60,000 for it. And it just so happened I got COVID after that and was out for almost a month. So it just was crazy. And they are very happy with what we ended up revising for them. But, you know, not even having, I mean, a doorway 30 inches and this whole, I mean, it was crazy. And, you know, they had a ledge walking in and all that kind of stuff. I do have pictures now and I should have put them on there because it's all barrier free and so forth with that. But anyways, okay. Now, the time is now for OT and OTA professionals to start their own business focused on home safety and modification. So you guys see it all the time. All the PTs are starting their own businesses, right? OTs, OTAs can do it too. And we love PTs and we help tons of PTs and PTAs start their business as well. But again, we're trying to showcase today and really build up the OT profession that we are the ones that are the experts in home modifications. So what a perfect business to build and do. So who in here, and I know we talked about this a little bit before, but who in here already has their own business? Who wants to start their own business? So maybe even just put have business or want to start. If you could let us know where you're at with everything. Good, so we have quite a mix. I should have did a poll. That would have been cool to know like exactly how many are actually have a business versus want to start.
A lot wanting to start. This is the perfect time to start.
So we're going to talk about what you need to start your business. And I'm just getting ready to share a different screen here. So switch screen. Stop share. My screen is all funky, you guys. So new share. Okay, so and a lot of you probably know this already, and a lot of you on here are actually in our Therapy Business Builder program. But I'm going to talk about the program, and in the meantime, you'll learn what you need to do to start your business. So we've been doing our Therapy Business Builder program for almost 2 years now, and we completely revised it in April into a level system. So to help you get up and started so you can see your first client, we've developed the Level 1 program that helps you do all of that. And it talks about why us, and because we do the thing. We also help you guys become an age-friendly healthcare system, which is a whole nother topic. But within this program, we help you do everything from getting your business established within your state, getting all of the things you need with your business, in regards to email, domain, fax, business phone, all the training materials, financial education tools you need. We help you get credentialed with Medicare, because again, we believe in the hybrid approach. If you want to do private pay and a mix of, in Medicare, that's awesome. We help you with that. We go through that whole process. We do marketing training, logo design, business card, website training, policies and procedures. We have a whole policy and procedures that you're able just to customize for your own practice, and make sure that you have the compliance plans and things you have in place, including all the business forms. We do the training with EMR, billing, all of that kind of stuff. And it's a 3-month program. So our goal is to have therapists like us that started our own practice go from no practice to ready to see a client in only 3 months. And currently the price is $2,350. So, which is a steal considering the policy and procedure manual alone was over $11,000. So you guys can start your own practice. we can help you and save you time, money, and tons of stress. Plus, it's a business deduction. Your time is not a business deduction. So it's a valuable tool that we have in place to help you. If you are stuck on doing it by yourself, go to our website, click on the free resources, and download the top 15 list to start your OT practice. But I'd recommend talking to people within our Therapy Business Builder program and why it's going to be worth your time, money, and stress level to just go ahead and do that. But it's doable. And I just want to say you have to be willing to put the work in, especially when you are first getting up and going and doing the marketing and getting out there. But we have the tools to help you. Now, for those of you that are interested in the home modifications piece, the certification program that is brand new. Whoa. My screen gets hid by the thing, so I can never see where the buttons are on this. For those of you that are interested in the certification program, that's what I'm going to have Sue talk about. Okay, and I just got to stop the share, and I got to share a different screen. Okay, so with our new certification program, Sue, you can go ahead and talk about it, and I'll get it up on the website as well.
Oh, okay. I thought you were going to do the other video, but
yeah, I will. If you just want to go over the basics here,
yeah. So one of the things that's really important to understand is when you do a lot of the other certifications, it just talks generally from a range of different professionals' perspective. And it doesn't give you the really specific tools as an OT or the background as an OT to be able to talk the language of construction and understand it, but also to look at how do you do a scope of work? How do you do the actual assessment? What things do you need to assess? How does that look when you're doing it for Medicare? How do you put that together with working with the client? What if you need to pull in DME? How does that look like that? What are the ethics of, in construction, people get a lot of referral payments. How does that work when you're an OT? What are the ethics for that piece? So these are all the things that we put together. I think the video,
and we were going to show you the video. How long is the video, Sue? Since we're
5 minutes.
Okay. Should we just have them watch that on their own, and then I'll just kind of open up these different links so they can at least see this?
Yes.
Or do you want them to watch the video? What would be best?
And for people who have to leave, A, you'll get the links to this, and B, you will get a copy of the video as long as you register to get in. You'll be fine with getting that. So, so it's broken into 5 modules. All right. And there's about 20 hours of time commitment for each of the modules, but it looks at pulling together the information that you need to get that practice in place. So the first module looks at really what is a hybrid practice? What does that look like? What are the Medicare rules in terms of billing? How do you decide if it's cash, or how do you decide if it's got to be billed, excuse me, to insurance? What does it look like for the ethics? Those are all the pieces there. But then we also look at legislation. What about things like ADA, visitability, county, universal building designs and legislative laws? So all of those things, we get a guideline on how to do that. And when we look at that, if it just says, the whole piece about how do we then build a Facebook group and a web page, a website to start marketing and setting up your program. So it's kind of that whole helping you get through all of that piece. And then we get on to module 2, which is really the hammer and nails. Notice hammer and nail, not nuts and bolts. If we want to just go down beyond the goals, basically what you're going to do with this is you're going to look at how to read a floor plan, the basics of construction, Getting your systems in place so that when you get your first client, you've got a system there to decide what you're doing, how to use the policies and procedures manuals to work with mods, tools that you will need, different home mod certifications. Do you really need another one? What does that look like? Any of the environmental assessments, how to standardize what you're doing, why, and collect data while you're there to look at your effectiveness, client factors to consider, designing a ramp, things to consider in the bathroom, basic products. So some of that whole piece for OTs in that. The next module, module 3, is again now looking at, okay, done this, how do I develop a report? What does that look like? How do I do it in an effective way so that when I get paid, it's cost effective? What are my options for doing that? What do I need to have in place before my first visit? Do I have the right consent forms? Do I have the right release of information forms? What do I do in my first visit? What do I do afterwards? Can I use telehealth? How do I document? What is the scope of work and how do I put that together? When do I need it? We look at Magic Plan and Home for Life design. We then look at how do we choose insurances to be in network with? What are the fundings that we get, and how to look at DME funding and letters of medical necessity and how to write them and put them together. And then module 4, we go through a whole range of things related to specific populations. And so we've got low vision, dementia, spinal cord injury, Parkinson's, developmental disabilities, workers' comp. What if it's a rental property? What if it's for persons with mental illness? And then we have disaster and emergency planning, which often gets forgotten about. But if we think about all the things that have happened in the last year, I think we've realized that disaster and emergency planning is now becoming an important part of that we need to consider. And then number 5, that module looks more at cash-based services. What are our options? How to work with contractors, real estate agents, adult aging services. We could review things like the senior safety specialist. We also look at roles for COTA, working with nonprofits, components of accessible design, product selection. So here we're looking more at design, kitchen design, all of those kinds of pieces, and project management. So this one's kind of looking at broadening your practice beside the medical necessary and that kind of general fall prevention to broader components. Any questions?
And just to go over, so with the certification program, the introductory price we're doing through August 1st is all 5 modules are $2,000. If people want to purchase the individual models, they can do so at $500 with that. The only additional expense with the certification program is as part of module 5, we are including the senior home safety specialist as it fits in with some things that we are utilizing within that module. And you get that at a reduced $100 off the normal price with that. And it's a 2-year renewal for the certification program. And as far as a timeline, module 1 is being released July 1st. Module 2 will be released August 1st, module 3, September 1st, module 4, October 1st, module 5, November 1st, because again, these modules are huge with a lot of information. There's quizzes, there's basically, you're going to be building a portfolio to utilize within your practice. So there's going to be tasks that you are needing to do to make sure you pass the modules and meet the requirements of the certification program. So with each module, once you complete the module, meaning all of the trainings, the quiz and the homework, then you attend a live training for that module. So the first live training will occur in August, and that's for everyone that completed module 1. In September, the live trainings will cover module 1 and 2, and then it just kind of builds out. And then after, starting in the first of the year, we will have live trainings ongoing in order to, alternate in order to make it work. So yes, the price is increasing after August. There's over 100 hours of training and education within these programs. So it's a very, very extensive certification program. As far as CEUs, currently no CEUs for this certification. We will tell you that we are applying for CEUs through AOTA. It'll just depend on when we get that approval, and then we'll have to go through getting all of these approved, but they all already have the objectives, they already have the assessments, they already have everything in there to meet a lot of requirements for CEUs. So depending on where you're at, you might be able to use this for some of the different things out there. It's definitely doable over the course of a month. So we just recommend 1 month for one module. I mean, you could complete a module in a week if you wanted to, but we just thought the 1 month per module made the most sense to help people get through the content. The live trainings will be in the evening. So Sue is Pacific time. So she like 7:38 is usually the earliest, right, Sue, for the training.
To look at reducing my patient load. So I've just hired as well. I've just hired an office manager, and then I'm looking at following Kara's lead and hiring an OT and a PT. And so I'm going to try and move my time a little further forward, but we also have to accommodate people on all the coasts. So.
So as far as with the level 1 program, so if you haven't started your business, we recommend you doing the level 1 first, because that's going to get you everything that you need to get your business up and going. And then this certification is going to give you really, really deep dive into the home mod certification. And yes, you will have the HAST certification, or the by you. The senior home safety specialist, Sue, we've been working with them, and they are going to be doing age friendly. No, not age friendly.
Age Safe America.
Oh yeah, Age Safe America. We've been talking with them, and they're going to be helping with marketing and getting the word out. We're working with Anthony Meritato with his new website that he has, where people can post their businesses out there, to have a special part of it being for those who are in our program. So trying to build out a directory and so forth with this. So Age Safe does have a directory. Great questions that you have. Good. I'm just trying to read through your guys' questions if I missed anything.
Erica just had a question about, can the price be extended? I'm in school and can't swing additional coursework right now. I think reach out to Kara.
Yeah, we'll see how we go. Just like I said, with the amount of materials and information within this course, it's kind of a steal. I mean, I obviously know that $2,000 is not a little chunk of money, but for the amount of materials that's in it, you know, we will probably be putting out a payment plan to help people as well. And we haven't decided on the official price increase either for August. So as far as timelines, people can register anytime. So right now, the only thing that you can sign up for is the certification program, which includes all 5 modules. You just need to understand that module 1 is the only one that's open. Module 2 isn't going to open till August 1st. Module 3 isn't going to open till September. Module 4 isn't going to open till October. Module 5 isn't going to open till November. After the first of the year, someone can sign up and all the modules are going to be open. So technically they could do a module a week if they wanted. But we're opening it 1 module a month as we roll it out. And the live trainings, they'll be at least an hour. I know someone was asking about the time with that. So, but people can sign up at any time. So you can sign up now, you can sign up next week, you can sign up. It's not going to be like limited, you know, to certain times in the year. It's an evergreen program where you can sign up at any times. You're just going to need to be cognizant, and this is where we're going to really have to educate people on. In order to get the certification, you have to finish all the modules and you have to do the live trainings to meet the requirements. So, you know, you have to kind of pay attention to when the live trainings are offered. And if there's a huge need for a live training in a month that we don't have scheduled, I mean, we'll definitely accommodate. Yes, so everyone that completes this certification and maintains their certification is within our certification, Facebook group. If we find a better means than Facebook, we'll switch to it. But right now, just having a private Facebook group is nice so that we can you know, have everyone that are certified within that group and so forth. So, yes, the price isn't changing until August 1st. So, I mean, it's 1 month out there. And yes, you cannot come to the live training until you've completed all the module, because we want to make sure that you've completed all the module, done the quiz, done your homework, so that you're coming to the live session prepared and, you know, ready to ask any questions and have a good discussion regarding everything that you learned. Yeah, so I will tell you that the people with the business builder, if you do the business builder program, there will always be better pricing for people in our therapy business builder program. So it'll probably stay around that $2,000 range, at least for a while, for those of you in our therapy business builder program. So your homework and so forth will be submitted online, and then Sue will be the ones that will be going through and reviewing your assignments.
And the projects are really focused on you building your practice, your portfolio, and your skills. They're not busy work. They're really directed to you building your practice.
Yeah, we don't want any busy work. We want stuff that you can utilize to help market and grow and build your practice. And Erica, yeah, we recommend if you are wanting to do this as a business that you do level 1, because again, that's everything you need to get your business up and going and ready to see clients with that. Good questions. Any other questions you guys have?
If you already have your business set up and you're really wanting to push now into home mods, then that's a different piece. But if you're needing to start to set up your business and set up the Medicare credentialing, then that's where you need to start to get that basics in there so that you can really take what we're teaching you and apply it straight away. And yes, this is something a new grad can definitely go into. There's going to be the support. There's going to be enough of helping you go through step by step that you can definitely do that. And even, like I said, I've been doing this 40 years. I'm still learning stuff every day. And so again, you just might have a steeper learning curve on some things, but definitely no, go for it. Like AOTA says, home modifications is a really good OT generalist skill, but we're training you now to be a specialist and to apply those beyond that. But you, as a graduate, you have those generalist skills.
If there's anyone on here that was part of our business builder home modification program that we ran, I don't even know when it was, but you will all be getting a special email how you will transition into this certification program. So just to let you guys know.
Any other questions? Hopefully we'll give you some information as well that's valuable. And like Cara said, there are things there. If you have questions, reach out to either of us. Please join that Facebook group.
Oh, yeah. Let me share the link.
I pasted in again. I already did it once. I just did it again.
Okay.
So please join that. It's specialized on home mods. There's, you can get answers there as well. It's a great place to be. All right. Well, I'm hoping that the content was helpful. And we look forward to hearing more from you and seeing you on our groups.
Awesome. Thank you, guys. Have a wonderful night, and you can always reach out to us if you have additional questions. levelot.com. And if you need to set up a call to jump on and ask specific questions, we have those available as well. But we'll just send it all out in an email following the training, so you guys get the replay and all of that information. So have a fabulous night and go OTs and start taking over the world of home mods. Bye, everyone.